Hi, everyone. So I'm Karen Peterson, and I'm with Passages Wellness and Counseling for Women. And I'm here today with one of my wonderful colleagues, Kristen Otata. Kristen, welcome.
Hi, Karen. Thank you for having me.
I'm so excited to have you today. So this is such a timely, important conversation. I really want to talk about trans affirming care today and anything else that comes up related. But Kristen, this is such a topic that I know is certainly timely with what's going on in the world, but also in particular for you, this is a topic that you have found a real passion and compassion for. So why don't you tell us just a little bit about you, how long you've been with us, and then, you can get right into your interest in this work.
Sure. So I am a licensed mental health counselor. I've been with Passages for about 2.5 years, and I've loved every moment of it. And as far as my interest in this work, I would say that it was a natural expansion of just my general interest in gender and how it intersects with various mental health challenges. I came to Passages based off of a real big love of working with women, but I also really do love working with the LGBTQ plus community population, I should say, in general.
Yeah, that's great. So I think maybe we just can like level set a little bit. So why don't are you able to describe in your own words what would you consider there's a lot of buzzwords that I think some people are very familiar with, some are less, but so let's start with what's trans affirming care.
hmm So we differentiate between affirmation and acceptance by really looking at the word acceptance as sometimes being equivalent to tolerating. And what we do not want to do is give our clients the impression that we tolerate their gender identity, but that we affirm them. So we consider them holistically and consider their gender as an important part of who they are, even though it may be the case that that's not what's bringing them into therapy sometimes.
Right. Yeah. So that they may be not be coming for an issue with transition or an issue with coming to terms with, you know, um, things that they've been struggling with or trying to figure out. Maybe that's not the case.
Right.
Okay. And so, your affirming would be what? Could you give an example of what being an affirming therapist would be for someone, for a trans person? What would that look
Sure. So being affirming is just making it part of the conversation and not making it a stigmatized part of the conversation. So the way in which we can normalize preferred names, pronouns, exploration of how gender impacts one's life. The things that we can do within our office to also signal that being a trans affirming provider is important to us. Here at Passages, for example, we have the most updated version of the Pride flag available in both locations so that someone just coming into our waiting room can see at eye line that we are allies.
That's great. Yeah. So I think one of the struggles that we've heard from, you know, anyone who's part of a marginalized group might be, the time that it takes to get somebody up to speed on the cultural and societal issues that they're experiencing. Um, that can take away from the therapy process. I do believe that it's our, obligations as clinicians to ask, like, what is that like for you? Um, but just having a background understanding of cultural and societal issues. Tell me a little bit about how you see that as the responsibility of the clinician.
Absolutely. I do think that's a huge part of what it means to be a trans affirming provider is that you are not putting the burden onto your client of giving you a crash course 101 on gender identity, how gender differentiates from sex, all of those things. So coming in with a full background and even going beyond those basics to also like what is going on societally, what are the percentages of different mental health disorders or different things such as hate crimes that the transgender community is more predisposed to be a victim of.
Yeah, for sure. So having that background knowledge and
Mhm.
putting that on, almost as an assumption for the clinician to know going into that this
Right.
could be a factor. And again, might not be. because not
Right,
every,
might not be, but you don't want your client to have to be in the position of explaining a whole background of things that don't necessarily apply to them before you can even get to their unique experience, which of course, that is the point at which, as we would do with any other client, we turn it over to them to invite us into their experience.
or yeah. So what are some things that you see, whether you're treating a trans person or a family member of a trans person, what are some of the clinical issues that come up?
Yeah, so some of the clinical issues that you might see, depending on the kind of supportive community that a transgender person has, is, themes of shame, potentially history of, mood disorders. Sometimes we see self-harm in the trans community. And some of the clinical issues that we might be working on is, transition related things, helping them through this period of their life, building resiliency, cultivating community, general identity exploration, just helping them again to achieve this gender euphoria and navigate the world in as functional of a way as possible.
So I'm picking up on the word gender euphoria. So we
Mhm.
hear gender. So can you talk a little bit about gender euphoria, gender dysphoria, what that
Mhm.
means to you?
Yeah, so I mentioned a little bit earlier, like that difference between gender and sex. And so we have the sex that you're assigned at birth, and then we have our gender, which is how we present. And when someone experiences gender dysphoria, those two things are not aligned. When someone experiences euphoria, it may not be the case that certain things are now aligning physically, but rather they are experiencing the euphoria of being recognized the way that they truly feel and identify.
Yeah. And one can only imagine how important that is. So if
Mhm.
for someone who may not understand that, it's easy to just think about your own experience and how does that feel for you? How important is that to you that that lines up and makes sense for you? So yeah, I think that your interest and passion is very clear. So what are some things that you would want to say to a trans person or a family member, just in thinking about pursuing getting treatment?
I think that going into an intake appointment, you may want to have a checklist of something that you feel is being displayed in any part of the process leading up to and including sitting down with your prospective clinician. So, what are you finding on their website? What was your experience like with the intake coordinator? We have Lindsay here, who's fabulous and generally helps people with a warm handoff to our clinicians. What are you seeing in the office as you come in, as I mentioned earlier? And then the other piece is when the session comes to a close, that initial session, and you are asked, as we do here at Passages, what are your needs in counseling? And do you have any questions for me? A lot of times, because the intake can be an overwhelming process, people are maybe ready to finish for the day and they don't have questions, but that is your time to turn things around and let yourself be the interviewer and be able to see, does this clinician meet your needs? Are they familiar with trans-related issues? Are they keeping up on education? Are they reading literature? Do they have experience? You are completely at liberty. And I think we personally, as clinicians, would love to be asked these questions so we can get that jump start on really forming that alliance so you can know, I hear you, I see you, and I'm ready to support you.
I love that. Well said. So thank you for that. I know that is something that you do and you would be open to doing, and that you are such an ally. So, and we hope to be at Passages. So, thank you so much for watching. And if this is an interesting topic, please leave a comment for us. Let us know that you'd maybe like to hear more about this, or any other topics. Leave a comment, like, and subscribe. We're also on Instagram, and Facebook. Did I miss any others? We're not yet on TikTok, but
Not
maybe one
yet.
of these days. So thank you so much for joining me and for this wonderful conversation, Kristen.
Thank you so much, Karen.
Take good care of yourselves.
Yes, you too.